As we age, our bodies undergo a myriad of changes, some subtle, others more pronounced. While some aches and pains might be easily brushed aside as simply getting older, it's crucial to remain vigilant, especially when it comes to the health of vital organs like the liver. Often referred to as the body's silent workhorse, the liver performs over 500 essential functions, from filtering toxins to producing vital proteins. But liver disease can creep up subtly, with symptoms easy to misinterpret or dismiss, particularly in the elderly whose bodies may already be facing other age-related challenges. Learning to recognize the early warning signs can be life-saving. This article will delve into 5 key physical indicators that could suggest your elderly loved one is struggling with liver disease, empowering you to seek timely medical attention and potentially improve their quality of life. Because recognizing these early signals can make all the difference in preserving their health and well-being. 1. White nails, a pale indication of underlying issues. Nails, often considered a mere cosmetic feature, can actually serve as miniature health barometers, reflecting the state of our internal well-being. Changes in nail color, texture, and shape can often signal underlying health conditions, including liver disease. One particular sign to watch out for in your elderly loved one is the appearance of white nails, also known as leukonychia. While a small white spot here or there is usually harmless and often attributed to minor trauma, a more significant whitening of the nail, particularly if it affects multiple nails or the entire nail bed, warrants attention. In the context of liver disease, white nails often arise due to reduced blood flow to the nail bed and decreased albumin production. Albumin, a protein primarily produced by the liver, is essential for maintaining fluid balance in the blood. When the liver is compromised, its ability to synthesize albumin is impaired, leading to a condition called hypoalbuminemia. This protein deficiency can cause fluid to leak out of the blood vessels, resulting in swelling in the extremities, including the fingers and toes, and contributing to a pallor in the nail bed. The reduction in blood flow further exacerbates the issue, depriving the nails of essential nutrients and oxygen, leading to their characteristic whitening. It's important to distinguish leukonychia associated with liver disease from other potential causes of white nails. These can include fungal infections, nail injuries, anemia, kidney disease, or even arsenic poisoning. However, if your elderly loved one presents with widespread white nails, especially in conjunction with other potential symptoms of liver disease, which we will discuss later, it's crucial to consult a physician for a comprehensive evaluation. A simple blood test can assess liver function and albumin levels, helping to determine the underlying cause and guide appropriate treatment. Remember, white nails are just one piece of the puzzle, but they can serve as a valuable early warning sign, prompting further investigation and potentially leading to earlier diagnosis and intervention for liver disease. 2. Jaundice, a yellowing of the sclera and skin. Perhaps the most well-known and easily recognizable sign of liver trouble is jaundice. This condition is characterized by a yellowing of the skin, the whites of the eyes, sclera, and mucous membranes. The yellow discoloration is caused by a buildup of bilirubin, a yellow pigment produced during the normal breakdown of red blood cells. The liver is responsible for processing and excreting bilirubin from the body. When the liver is not functioning properly, bilirubin accumulates in the bloodstream, leading to jaundice. Think of bilirubin like a byproduct of a factory that needs to be regularly shipped out. If the shipping department, the liver, is failing to keep up with production, the byproducts start to pile up, eventually overflowing and becoming visible. In the elderly, jaundice should never be dismissed as a normal sign of aging. It unequivocally points to an underlying medical issue requiring immediate attention. Several liver diseases can cause jaundice, including hepatitis, viral or alcoholic, cirrhosis, scarring of the liver, liver cancer, and bile duct obstruction. The severity of jaundice can vary depending on the extent of liver damage and the level of bilirubin in the blood. In addition to the yellowing of the skin and eyes, jaundice can also be accompanied by other symptoms, such as dark urine, pale stools, itching, pruritus, and fatigue. If you notice any of these symptoms in your elderly loved one, it's crucial to seek medical attention immediately. A doctor can perform blood tests to check bilirubin levels and liver function, as well as imaging studies, such as ultrasound or CT scan, to visualize the liver and bile ducts. Early diagnosis and treatment are crucial for managing liver disease and preventing serious complications. Remember, jaundice is a clear signal that something is wrong with the liver, and prompt medical intervention is essential to protect your loved one's health. 3. Abdominal swelling, ascites fluid accumulation in the abdomen. Ascites is the pathological accumulation of fluid within the peritoneal cavity, the space between the abdominal organs and the abdominal wall. It manifests as abdominal swelling and distension, making the abdomen appear tight and full. While ascites can have several underlying causes, it's a common complication of advanced liver disease, particularly cirrhosis. In the context of liver disease, ascites typically develops due to a combination of factors. Firstly, as the liver becomes scarred, cirrhotic, blood flow through the liver is impeded, leading to portal hypertension, an increase in pressure within the portal vein, which carries blood from the digestive organs to the liver. This increased pressure forces fluid out of the blood vessels and into the peritoneal cavity. Secondly, a failing liver is often unable to produce sufficient amounts of albumin, the protein responsible for maintaining fluid balance in the blood. Low albumin levels, hypoalbuminemia, cause fluid to leak out of the blood vessels, further contributing to ascites. Recognizing ascites in an elderly individual can be challenging, as abdominal swelling can also be caused by other conditions, such as weight gain, bloating, or even bowel obstruction. However, certain characteristics of ascites-related swelling can help differentiate it. The swelling tends to develop gradually, often starting with a subtle increase in abdominal girth. As the fluid accumulates, the abdomen becomes progressively more distended and feels taut or firm to the touch. Individuals with ascites may also experience shortness of breath due to the pressure of the fluid on the diaphragm, discomfort or pain in the abdomen, and difficulty moving or finding a comfortable position. If you suspect your elderly loved one has ascites, it's imperative to seek medical evaluation. A doctor can perform a physical examination to assess the abdomen and order imaging studies, such as an ultrasound or CT scan, to confirm the presence of fluid. A procedure called paracentesis, where a needle is inserted into the abdomen to drain a sample of the fluid, may also be performed to analyze the fluid and determine the underlying cause of ascites. Treatment for ascites usually involves managing the underlying liver disease, dietary modifications, such as limiting sodium intake, diuretics, medications that help the body eliminate excess fluid, and, in some cases, repeated paracentesis to drain the fluid. Early detection and proper management of ascites can significantly improve your loved one's comfort and quality of life, while addressing the underlying liver disease. 4. Skin changes, spider angiomas and palmar erythema. The skin, our largest organ, can often act as a window into the health of our internal organs, including the liver. Certain skin changes, although sometimes subtle, can be indicative of underlying liver disease, particularly in the elderly. Two such signs to watch out for are spider angiomas and palmar erythema. Spider angiomas, also known as spider nevi or spider veins, are small, dilated blood vessels that appear as tiny, red spots with radiating capillaries resembling spider legs. They are typically found on the face, neck, upper chest, and arms. While spider angiomas can occur in healthy individuals, particularly during pregnancy, their presence in significant numbers or in conjunction with other symptoms of liver disease raises concern. They are believed to form due to elevated levels of estrogen in the blood, a common occurrence in liver disease as the liver's ability to metabolize hormones is impaired. Palmar erythema, on the other hand, is characterized by a reddening of the palms of the hands, particularly the thenar and hypothenar eminences, the fleshy areas at the base of the thumb and little finger. The redness may be subtle or more pronounced, and it can sometimes be accompanied by warmth or tingling sensations. Like spider angiomas, palmar erythema is not always indicative of liver disease, as it can also be caused by other conditions, such as pregnancy, rheumatoid arthritis, or hyperthyroidism. However, in the context of liver disease, it is thought to be related to hormonal imbalances and increased levels of vasodilators, substances that widen blood vessels. It's important to note that these skin changes can be difficult to detect, especially in individuals with darker skin tones. Therefore, close observation and a keen eye are essential. If you notice spider angiomas or palmar erythema on your elderly loved one, especially if they are accompanied by other potential signs of liver disease, consult with a physician. The doctor can perform a thorough examination and order appropriate tests to evaluate liver function and determine the underlying cause of these skin changes. While these skin manifestations may not be harmful in themselves, they can serve as valuable clues, prompting further investigation and potentially leading to earlier diagnosis and management of liver disease. 5. Cognitive changes: confusion, forgetfulness, and hepatic encephalopathy. Liver disease doesn't just manifest in physical symptoms. It can also significantly impact cognitive function, particularly in the elderly. When the liver is unable to properly filter toxins from the blood, these substances can accumulate and affect the brain, leading to a condition known as hepatic encephalopathy, HE. This condition can manifest in a range of cognitive and neurological symptoms, from mild confusion and forgetfulness to more severe alterations in consciousness, personality changes, and even coma. The exact mechanisms underlying hepatic encephalopathy are complex, but one key factor is the buildup of ammonia in the bloodstream. Ammonia is a byproduct of protein metabolism, and the liver is normally responsible for converting it into urea, which is then excreted by the kidneys. When the liver is failing, ammonia levels rise, and this neurotoxin can cross the blood-brain barrier and disrupt brain function. In the early stages of hepatic encephalopathy, the symptoms may be subtle and easily overlooked, particularly in the elderly who may already be experiencing age-related cognitive decline. Your loved one might exhibit mild confusion, forgetfulness, difficulty concentrating, or changes in their sleep patterns. They may also become irritable, anxious, or depressed. As the condition progresses, the symptoms can become more pronounced, leading to disorientation, slurred speech, tremors, particularly a flapping tremor of the hands called hysterexis, and even loss of consciousness. Recognizing these cognitive changes as potential signs of liver disease is crucial, as early diagnosis and treatment can significantly improve outcomes. If you notice any of these symptoms in your elderly loved one, particularly if they have a known history of liver disease or other risk factors, consult with a physician immediately. The doctor can perform blood tests to check ammonia levels and liver function, as well as neurological assessments to evaluate cognitive function. Treatment for hepatic encephalopathy typically involves reducing ammonia levels in the blood through dietary modifications, such as limiting protein intake, medications, such as lactulose and rifaximin, and addressing the underlying liver disease. It's important to be proactive and advocate for your loved one's cognitive health, as early intervention can help prevent the progression of hepatic encephalopathy and improve their quality of life. By being observant and informed, you can play a vital role in detecting early signs of liver disease in your elderly loved one. Remember, early detection and intervention are key to managing this potentially life-threatening condition and ensuring their well-being. If you notice any of these signs, don't hesitate to seek professional medical advice. Your vigilance and proactive approach can make all the difference.